name is Kester Jimmy Ned. I'm a neurologist on the faculty at the University of Miami School of Medicine. I've known Dr. Carrington since 1984. We were residents in training at the University of Miami-Jackson Memorial Hospital, and we first met while we were taking care of patients at the hospital. We've been friends ever since. Dr. Carrington is a highly trained specialist in the field of endocrinology. It's the field of medicine that deals with disorders of the endocrine system. So he manages and treats patients with complicated diabetes, disease of the thyroid glands. He also manages patients who are generally overweight. He does weight management. But what's unique about Dr. Carrington, he takes care of the most difficult and most challenging cases that are afflicted by these conditions. And that includes people with very severe chronic high blood pressure, difficult to control. Dr. Carrington is the kind of person who could, because of his skills, his credential, practice in a highly lucrative environment, but he's chosen to practice in low-income neighborhoods, and he cares for people who can't really access healthcare to a large degree. So as I've known him, he's the kind of person that sacrifices his own personal well-being, his own economic situations for the lives of others to better other people. I was particularly moved by Dr. Carrington in some of the work he's done in his ministry. One of the things he's engaged in is in an international ministry where he actually not only funds but directs a ministry to care for individuals in countries where they do not have the opportunity to access the level of health care that we have in the United States. On a regular basis, he takes trips to Latin America, the Caribbean, and I guess he does this in connection with his church, to actually work with people in those regions to help promote not only his ministry, but also quality health care. And they provide free care, medications, education, training for individuals in those countries. So he is a giant in the community in the sense that he's able to provide this kind of service to individuals who are less fortunate. The issue of physician extenders, what we call physician assistants and nurse practitioners, their role in providing care is not as defined as we would like to. But yet, the demand for their services have increased so much because of the economics of healthcare that the legislative mandates have not, the laws that have been passed have not kept up with the services that they render. So as such, physicians and nurse practitioners are under a lot of pressure to extend whatever service boundaries there are to provide care. Just as an example, I always use the example that you can't be in two places at the same time. I'm a very busy physician. I was in Hawaii last week, and I have patients that are on substances that need renewal. I'm not there. Now, I may have a colleague that covers for me, but that colleague was not available. But the patient ran out of the medication. How do you take care of it? There are ways and means that many physicians have to do this if they work in a large group. But if you work as a solo practitioner, it's a very difficult issue to resolve. And as such, we rely on physician extenders to be able to do this. What's actually conflicting about this issue of physician extenders is that on the one hand, we restrict them, and on the other hand, we give them privileges that even go beyond what most people would expect. I mean, we have physician assistants and physician extenders perform services that are some of the highest risk procedures, and we allow them to do this, but yet we can't allow them to take the responsibility to prescribe and be involved in dispensing medications at a certain level. And I do understand the limitations that the government has placed, but the pressure is so intense that the idea of how we allow them to prescribe is a highly controversial issue. When you analyze the entire picture of what's going on in the medical community, Dr. Carrington is not alone in this regard in terms of how these issues are executed and administered. At this point, if one looks at what's actually happening in healthcare relative to the government, recent laws that have been passed to regulate and better manage prescription medications and other controlled substances. Clearly, there is a sort of mismatch between what the intent of the legislation is and what's actually going on in the industry. I'm standing for Dr. Carrington, and I'm asking you as colleagues to take a stand also. And I hope that you will do the same as I am. And I feel that it's important for us to step out and put a neck on the line and make a commitment. I hope that you understand the situation that Dr. Carrington is in, his family, the community that he serves, the patient community, his employees. This is a very difficult situation, and we need to be there to support him. And I trust that you would understand that any one of us could be in that situation. I know that Dr. Carrington would stand up for us. Therefore, I'm taking a stand. Will you do the same?
Dr. Carrington personally and professionally for over 20 years. Dr. Carrington is an individual of excellence, both in morality and as a professional. Dr. Carrington is one of the primary reasons why I became a physician. It was through seeing him in practice and in his everyday life that I realized that there's a higher standard to which we as individuals and people can aspire. And as a result, I sought to emulate him. The interesting thing about Dr. Carrington is that he would care for patients irrespective of their ability to pay. I have worked in areas that have low income as a socioeconomic background per se, and yet he works in those areas as well and continues to care for those patients without regard for what they are able to do or not do in terms of reimbursements. I, as a clinician, am very concerned. I'm in primary care, and oftentimes we are directly faced with treating individuals who are in pain. It is concerning to me when I have to worry about whether or not a prescription that I write to treat an authentic pain-needing patient, per se, or patient in pain who needs medication, I have to decide whether or not I have written a certain number of scripts so that I may stay under the radar, so to speak, of the government's dictates. I am not able to practice medicine as freely as I should be able to practice medicine in this particular state at this particular time. Dr. Carrington has treated my patients. I worked at an office in what is considered to be a socioeconomically challenged neighborhood. And Dr. Carrington has cared for my patients diligently. And he has saved the life of one of my patients as a result of his diligent work. I can definitely say that without him practicing in that community, my patients would not be well off, and in one case, my patient would have died. I am standing for Dr. Carrington, won't you?